response and to aid our local governments. We also have approval from FEMA to provide hotel accommodations for our first responders and essential personnel working to combat the COVID-19 epidemic. I want to remind Virginians, even though we continue to see cases go up, that doesn't mean that social distancing is not working, because it is. The point of social distancing is to slow the spread, not eliminate it entirely. We'll continue to see cases that are new, and unfortunately, we will continue to see deaths from this pandemic. But our actions are keeping those cases to a level that our hospitals can manage. Our hospitals continue to need more personal protective equipment. So it's good news that our first shipment of PPE procured through a contract with Northfield has arrived in Virginia and is being distributed. This includes more than 24,000 N95 masks, as well as gloves and gowns. We expect more shipments from this order in the coming weeks. The national supply chain issues around PPE remain a problem. We're trying to work around those by diversifying our sources, so we have multiple different ways to get PPE. I'm proud of the innovative ways our healthcare providers are coming up with to stretch their PPE supply, such as decontaminating masks with ultraviolet lights. We're also working to help our hospitals and long-term care facilities ensure they have the staffing they need to take care of their communities. Today, I signed Executive Order 57. It eases licensing restrictions on some medical professionals like nurse practitioners and doctors who are licensed in other states, and it allows more use of telehealth. We'll let nurse practitioners with 2 years of experience practice without having a practice agreement with a physician. We'll allow out-of-state doctors and other healthcare practitioners to practice in certain Virginia facilities. We also allow out-of-state doctors to keep seeing their existing patients who are Virginia residents, which is important in our border communities. As a doctor, I know this pandemic is placing extraordinary demands on our doctors, nurses, nurse practitioners, PAs, and other staff. This order will allow us to expand our workforce so that more trained medical professionals can step in and help meet the need. It is also critical that we are meeting the staffing and support needs of our long-term care facilities. The health of people living and working in our nursing homes and long-term care facilities remains a concern and a priority. We are waiving regulatory rules around staffing to ensure that facilities can recruit staff and volunteers more quickly. We're connecting our Medical Reserve Corps volunteers with long-term care facilities that are seeing staff shortages to help fill that need. We'll also reach out to local health systems that have furloughed staff to encourage them to help. The National Guard can help train staff on how to best use PPE. And I want to highlight some changes to ensure we are doing more testing in long-term care facilities. We are expanding our testing criteria to include people who are about to be admitted into congregate settings, like long-term care facilities. This is an important safety measure to help prevent the virus from being brought into these facilities. We will work to make sure that any nursing home or long-term care facility experiencing a breakout can test every resident in the facility as well as the staff. I'm grateful to VCU and UVA for partnering with us to do these tests for our facilities as resources allow. The state lab will also help provide testing supplies. All of these steps will help support our nursing homes and long-term care facilities, which are struggling to keep their residents and staff safe.